Perioperative hypothermia, causes, consequences, and management. Introduction. Hello and welcome to today a Euro Trademark S presentation on perioperative hypothermia. A significant concern in the care of surgical patients under general anesthesia. As health provider, understanding hypothermia is essential to providing optimal patient care. In this video, we'll dive into the causes and consequences of perioperative hypothermia and explore the best management strategies to prevent, monitor, and treat it effectively. What is perioperative hypothermia? Perioperative hypothermia refers to an abnormal drop in body temperature below 358 degrees C, 958 degrees F, during the perioperative period. The time surrounding surgery, including preoperative, intraoperative, and postoperative phases. A trademark S common in patients undergoing surgery under general anesthesia, and its effects can range from mild discomfort to serious complications that can affect the overall outcome of surgery. Causes of perioperative hypothermia. Understanding the causes of perioperative hypothermia helps us better prevent and manage it. Hypothermia during surgery can arise due to a combination of factors. 1. Impaired thermoregulation due to anesthesia. Anesthesia, particularly general anesthesia, affects the body's ability to regulate temperature. Volatile anesthetics, for example, depress the hypothalamus, which is responsible for regulating body temperature. This makes it difficult for the body to respond to cold stress by shivering or adjusting blood flow to the skin. 2. Exposure to the cold operating room. Operating rooms are often kept at a lower temperature to maintain sterility and comfort for the surgical team. However, this environment can lead to significant heat loss for the patient. With exposure to cold air, especially if large body areas are uncovered during surgery, heat loss can occur rapidly. 3. Exposure of body cavities and organs. During surgery, particularly in procedures involving large incisions or organ exposure, significant amounts of body heat can be lost. For example, abdominal or thoracic surgeries may lead to loss of heat from internal organs. 4. Cold infusion of fluids. The intravenous fluids or blood products given to patients during surgery are typically at room temperature, which can contribute to the patient's cooling. This is especially concerning in lengthy surgeries or those requiring large volumes of fluids. 5. Patient characteristics. Certain patient factors increase the risk of hypothermia. Older patients, those with low body fat, or those who are already at risk of poor circulation may be more susceptible to heat loss during surgery. Additionally, patients with hypothermia before the surgery, due to environmental factors or illness, are at higher risk. Consequences of perioperative hypothermia. Hypothermia during surgery isn't a trademark T just an uncomfortable experience for the patient. It can have significant consequences on the patient. Trademark S health and surgical outcome. These consequences can range from mild to life-threatening, depending on the severity of the hypothermia. 1. Increased risk of bleeding. One of the most critical consequences of hypothermia is its impact on coagulation. Cold temperatures impair platelet function and slow the activity of clotting factors, making it more difficult to control bleeding during surgery. This can lead to excessive blood loss and increase the need for transfusions. 2. Delayed drug metabolism and prolonged anesthesia recovery. Hypothermia slows down the metabolism of anesthetic drugs. As a result, patients may remain unconscious and have a delayed recovery from anesthesia. This can increase the risk of post-operative complications, such as respiratory depression and cardiovascular instability. 3. Shivering. As the body attempts to conserve heat, patients may experience shivering. While shivering is a natural thermoregulatory response, it significantly increases oxygen consumption. heart rate, and metabolic demands, which can be dangerous for already stressed patients, particularly those with cardiovascular issues. For cardiac arrhythmias, severe hypothermia, especially when body temperature drops below 308 degrees C, 868 degree F, can lead to dangerous cardiac arrhythmias, including ventricular fibrillation. These arrhythmias can cause hemodynamic instability and even cardiac arrest if not promptly managed. 5. Impaired immune function. Hypothermia can impair the immune response, increasing the risk of infections after surgery. Prolonged exposure to cold can slow the immune system, a Euro trademark's ability to respond to pathogens, which increases susceptibility to postoperative wound infections or other complications. 6. Increased risk of postoperative complications. The combined effects of delayed recovery, increased bleeding, and impaired immune function lead to a higher risk of complications such as surgical site infections, delayed wound healing, and prolonged hospital stays. Management of perioperative hypothermia. Now that we Euro trademark VE covered the causes and consequences of hypothermia, let a Euro trademark S discuss how to effectively manage and prevent it during the perioperative period. Management strategies focus on both prevention and active treatment. 1. Prevention strategies. Preoperative warming. A key strategy for preventing hypothermia is pre-arming the patient before anesthesia induction. Forced air warming blankets are commonly used for pre-arming. Studies show that warming the patient for 30 minutes before surgery can significantly reduce the incidence of perioperative hypothermia. Warming the operating room. The operating room temperature should be adjusted to an appropriate level to minimize heat loss, while surgical teams need a cool environment. Maintaining a temperature between 20228 degrees C, 68728 degree F, helps reduce the risk of hypothermia in patients. Warming intravenous fluids. All intravenous fluids, including blood products, should be warmed to prevent heat loss. Use fluid warmers to ensure that fluids are administered at body temperature, 378 degrees C, which prevents additional cooling of the patient. Insulating the patient. Covering the patient with thermal blankets can minimize heat loss. This is especially important during long surgeries. Thermal wraps should cover as much of the body as possible to help retain heat and keep the patient warm. Minimizing exposure. Reduce the exposure of the patient to Euro trademark S body as much as possible during surgery. Keeping the limbs and internal organs covered when not actively being worked on helps conserve body heat. 2. Active management during surgery. Forced air warming systems. Forced air warming is one of the most effective ways to actively warm a patient during surgery. These blankets blow warm air over the patient to Euro trademark S body, raising their body temperature. This method is highly effective in preventing and correcting hypothermia. External heating pads. Heating pads can be placed on the patient's extremities or under the body to provide additional warmth. These should be used cautiously to avoid burns, particularly in patients with impaired sensation under anesthesia. Warmed humidified gases. During ventilation, the gases administered, especially when using mechanical ventilation, should be warmed and humidified. This prevents heat loss through the respiratory tract and helps maintain body temperature during surgery. 3. Monitoring and interventions. Core temperature monitoring. Core temperature must be monitored throughout the surgery to detect early signs of hypothermia. Bladder or esophageal probes are reliable methods to measure core temperature. If the temperature falls below 368 degrees C, interventions should be made immediately. Shivering prevention and management. If a patient begins to shiver, sedation or analgesia can be administered to reduce shivering and minimize oxygen consumption. Opioids or other mild Sedatives can be helpful in controlling this response. For postoperative management, I continued warming in the recovery room. After surgery, the patient should continue to be warmed in the recovery room. Forced air warming systems and additional blankets can be used to prevent further cooling. Monitoring temperature in the post-anesthesia care unit, PACU, is vital to ensure the patient returns to a safe, normothermic state. Shivering control. If shivering persists after surgery, pharmacological treatment such as meperidine, a mild opioid, can be used to alleviate shivering. This reduces the patient to Euro trademark S oxygen consumption and helps them recover faster. Conclusion. Perioperative hypothermia is a preventable condition, but its management requires careful attention and action throughout the surgical process. By understanding its causes and consequences, we can implement effective strategies to prevent and treat hypothermia, ensuring that our patients remain safe and comfortable. Pre-arming, maintaining a warm environment, warming fluids, and monitoring core temperature are all essential practices for managing hypothermia. Active interventions during surgery, including forced air warming and warming gases, can also help maintain normothermia. Thank you for watching today a Euro Trademark S presentation on perioperative hypothermia management. If you found this video useful, please like, comment, and subscribe for more educational content on anesthesia and perioperative care. Feel free to ask any questions in the comments below, and IA Euro Trademark LL see you in the next video.